Hello, everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. Woo! Okay, I am so excited today. Thank you all for checking in. If you look, you're going to see in your background, I am actually in New Jersey. Woo! Say hello to all my Jersey people. Yes, shout out to my medical school, New Jersey Medical School, Rutgers, New Jersey Medical School. I'll be stopping by today, so I'm so excited to meet you guys. Alrighty, so this is the Dr. Tamara Beckford Show, and I have the honor, the privilege of always highlighting my super fantastic doctor friends who are doing amazing things inside and outside the clinical space. So today I'm going to be bringing one of our allergist, immunologist extraordinaire. I'm going to give you all of her credentials before we get started, right? But let me tell you, if you are watching this and you're like, you know what? I want to hear what Dr. Wada has to say again. No worries. Her beautiful face will be available. That's right. On our Your Caring Docs website. That's Your Caring Docs, URCARINGDOCS.com. Just select podcast and you'll see all of the beautiful faces. Just click listen here and you'll be able to get a replay of today and listen in your car, get all the nitty gritty, all the juice, all the information that we're going to present today, right? And of course, you got to leave her a 5-star because you know she is going to bring the fire. We're so excited. Already next, if you are a doctor and you're like, you know what? I want to be on the show. No worries. Just send an email to Dr. Beckford at yourcaringdocs.com to book, and we will send you the info to book, and we will get you on the show. Do keep in mind our show is booked out 3 months in advance, so don't get discouraged, right? Do not get discouraged. If you have a grand opening, a book launch, a launch of anything that you're really excited for other people to know, just time it, and then we'll get you on so we could all talk about it. Today, we are bringing on, like I said, one of my sister docs. So I'm going to read her credentials to you because, you know, she is fired. You know, we're not just bringing on an ordinary person today. So we have this wonderful lady doc of ours who's a graduate from the University of Illinois College of Medicine, right? Then she did her residency in internal medicine and peds in our cool, we call it MedPeds, right? So internal medicine and pediatrics at the same time. She did that and she did fellowship, both of them at The Ohio State University. So I always say about everyone that is trained at Ohio State, went to Ohio State. I can't just say like, oh, you went to Ohio State. I have to say the. Oh, there we go. I love it. The Ohio State University. And then she did a fellowship in allergy and immunology there, right? So she was over there at Nationwide Children's Hospital, just really taking great care of the peds and the adults in that area. But as with most docs, she's like, you know what? I am built for more. There's a little bit more that I want to do. And she went and she got certified as a life coach. She's also a diplomat of the American College of Lifestyle Medicine. So this doc has got it all. She's also called, guess what? The Crunchy Allergist. She has been featured on many mediums. She's been on NPR, she's been on US News and World Reports, Popular Science, and Reader's Digest. I'm telling you all, I don't have my little clapping button today, but I'm going to give her a round of applause. The wonderful Dr. Kara Wada here. Woo! Thank you
blushing.
So much. Oh, you're just that awesome. So thanks for coming on. How are you today?
Thank you so much for having me. I'm doing great. I've been looking forward to this for a while now. And it's been really fun working with you a little bit more with Dr. Una.
Yes, I know.
Great. Yeah.
So excited. Like I said, build for more. Alrighty. So as with all of our wonderful docs who are on the show, you know, before we got the MDs and all the accolades, we were there, we were like little kids, and we said, you know what? I think I want to do that. So let's take it back to little Kara, who was there, who said, you know what? I want to be a doctor. Tell us the backstory. When did you decide to go into medicine?
So as far back as I can remember, my pediatrician growing up was actually my mom's pediatrician growing up.
Oh, wow.
And he, like, as his kind of second career, was a teacher at the University of Illinois College of Medicine clinic, like in our hometown. And
Nice.
so from an early age, I was seeing him. I was seeing medical students at,
Mhm.
I was kind of a little guinea pig. And I was just in awe of science, the human body, all of those things. I remember we would drive past the College of Medicine building, like on our way to and from my grandma's. My grandma watched me
Mhm.
for a while as my mom was working. And I told my mom at the time, like, I'm going to go to school there. I am going to, at the time, I thought you needed extra like training to teach medical students. I thought that's like maybe what a PhD was or something.
Mhm.
And so I said, I'm going to teach medical students too. And it's really cool to see how, nearly 40 years later, that really is kind of the bread and butter of my week.
Wow. Wow.
Yeah.
So, I love it that it all starts with the impression that you get from someone who is doing wonderful things and is leaving this imprint in your mind like, wow, I want to do that too. So you have your pediatrician who is also your mom's pediatrician. So now we're doing two generations of inspiration, right? So you'll be inspired two generations later. And you're also seeing this wonderful facility that you're driving back and forth. And I can attest to that because that's, a similar story for our medical school here in New Jersey, where you're looking and you're like, I want to be there. And then it's like, I am going to be there. And then in the end, you know, you're there.
Yeah.
So now you're in your medical school that you've been driving back and forth as a kid, and you're like, wow, I am now a student here. How did that feel?
It was a bit like coming home in so
Mm,
many ways. Interestingly, so at the time, and the system's changed a little bit since then, but at the
mhm,
time, University of Illinois, they still have 4 campuses, but at the time I started in Champaign-Urbana and then moved back up to the Rockford campus, which was my hometown campus. And I actually had this kind of crisis to some
mhm,
degree. As a second year student, I had met my who would turn out to be my husband in the
mhm,
first year, and he was at a different campus. So
mhm.
we kind of split, and but we split geographically but stayed
Yeah.
together. And so I had to make this decision for third and fourth year if I wanted to stay in this space that was felt like home, was my safe space, or did I want to take the leap and make the change to this other campus
Mm.
and move to a city that I was less familiar with, for love, but also factored in my education and deciding, if we were going to potentially couples match, did I want to invest that much into him and to this? And obviously, fast forward, 15-ish years later, everything worked out. I did make that leap, and
Mhm.
it's interesting how I don't know if I would have. I don't know if I would have found allergy immunology had I not made that decision or taken that risk.
Oh,
Um, that's how I ended up finding MedPeds. The campus I moved to was a very MedPeds friendly environment, and and yeah, the rest is history.
that is wonderful. So I love it. So you're there, in the school that you've been driving back and forth. And then
Mhm.
you're like, oh my gosh, it feels like home. And then in the second year, well, as if med school's transitioning from life to med school wasn't a transition enough. That alone is just such a huge transition. So shout out to all our first year students who
Yeah.
are starting in either the next day, the next few hours, you started yesterday, or next week. We understand the transition is hard. Hey, good afternoon, Florence. Nice seeing you. Thank you for logging in. Yeah, the transition is hard. So now, not only did you do that, now you're like second year, okay, I'm going to move to another campus where that means that's another transition. However, the beauty in the transition is the exposure, which is goes back to, your pediatrician. You got the exposure to realize like, wow, there's so much more out there. Now you've been exposed, and that's what I was going to ask you. What made you decide to do med peds, which is internal medicine for those who are just joining us? Internal medicine and pediatric residency at the same time. Some people are scared of kids. Some people are like, this is all I want to do with kids. And then you decided that you wanted to do both. Yeah. And the exposure brought you to that from being on this campus that really, like you said, it was a med peds heavy environment. All right. So now you're there and you've decided to do the match and you decide to go into allergy and immunology. Were there any other times afterwards that you said, I might do this particular fellowship or that particular fellowship? Oh, yeah? Okay, well, tell us. I see it in the face. Tell us the story.
So for the longest time, I thought I might do pulmonary critical care or a combined pulmonary type experience, which is kind of have to make your own program to some degree if you do both, peds and adult. I really enjoyed taking care of patients with asthma. I really liked the physiology kind of with respiratory medicine. I also, like, thinking back, really loved immunology. Like back to my undergrad days, that was one of my favorite classes that I took was an immunology course. But after a while, med peds is a pretty inpatient heavy curriculum, and you have quite a bit of time in the intensive care unit, whether it be the neonatal intensive care, the peds intensive care, and the adult medical ICU. And although like my first experiences in those environments were like ones of excitement and like, oh, you got to like get your hands like in your brain in the thick of it, like really turning around, in hindsight, cytokines many times that were going haywire, the physiology going haywire and trying to tame that. But that sexiness essentially kind of wore off on me after a while. I also realized that I am just a much happier human and I feel physically better in my health, both mental health and physical health, if I get good sleep. And I follow kind of the rhythms of our day. And those careers were not in alignment with what I needed, both, from a health standpoint and kind of the personal standpoint. Yeah. And I also realized I'm a person who feels a lot. And I noticed in the ICU, I very much had a tendency to get compassion fatigue. So I would like pour like so much like caring and concern and compassion into taking care of these patients that were critically ill and their families that were, incredibly worried and under a lot of stress and grief in many cases. And that took a huge emotional toll. And I saw elements of myself kind of shutting off that I didn't like. And so at that point I rotated. I was a third year med peds resident, so quite far in the game to really be thinking about other specialties. And that's when I rotated in our pediatric allergy clinic. And within a day of spending time in the clinic with someone who would come to still be my mentor, I had this sense of like weight lifting off of my chest, this expansiveness kind of feeling of, I could see myself waking up and doing this every day.
Oh, isn't that just amazing? And like we said, this all ties in to experiences, exposure that really aligns within you, and you figure out, oh wow, I am interested in this particular field, or I'm interested in this specialty, I rotate, I like it, but it's also important to understand, is this something that I can do forever? Because we've invested a lot of time, a lot of energy and training. And so, absolutely, is this something that I can wake up and do even when I'm completely worn out? And, let's give a great shout out to all our pulmonary and critical care
Oh my
people,
gosh, yes, absolutely.
especially in a time where we're having respiratory issues and all these patients with a lot of respiratory issues coming on. They've been working like overtime over the last 2 years, in addition to a lot of all our other specialties. But the exposure that you had in rotating in the intensive care unit, dealing with very sick people, adult and children, and also the fact that their families, that what the families are going through, and you said that emotionally it took a lot out of you. And in order to survive, your body started to shut down elements of it that made Dr. Wada. And in order to preserve that part of you, you rotated on another field in another specialty, which is allergy, and that part of you just came back alive.
Mm-hmm.
It's like within a day, just came back alive. And that's how you're like, I know that this is for me. And you've been doing that ever since.
Yeah.
That's wonderful. I love the story, and it's so important for those who are listening, who are deciding that, where do you want to lay your hat for, quote unquote, certain parts of your life. I won't say the rest of your life, because life is so dynamic, but at least for certain aspects of your life, for a certain period of time, where do you want to lay your hat? The exposure, getting your feet wet in either the specialty, the field, that career, it's just so important. So now we're here. Now I need to know, where did the Crunchy Allergist come from? This is just like, okay.
It started out a little bit as a joke. So in our fellowship experience, it's a 2-year fellowship for most programs. Sometimes there's an optional third year, but during my second year, I was expected to do a presentation for our whole department on a topic of my choosing. And so something that I have always had some interest in is the role of more integrative type treatment modalities in the care of asthma, allergies, and related conditions, in part because my patients were asking me about them. When you think about sinus issues, one thing that comes up time and time again is using like salt water to rinse out your sinuses.
Pots,
Exactly, neti pots, sprays, like all sorts of contraptions. And it's something that's been used for centuries, if not millennia, as a way to clean out our sinuses if we have a cold or what have you. And so I essentially did a review of what I could find on the role of yoga in asthma, the role of neti pots, different supplements. And out of that, some of my colleagues started kind of using the term, Crunchy Allergist and granola, crunchy,
okay, the non-traditional way.
It especially will come up, I think, in peds a little more. The moms that are a little more, and I tend to be that mom. Like I wasn't I actually had just become a mom at the time. I was learning how to baby wear and breastfeed and use some of these things that are a little more natural. And so it was essentially out of that then this nickname and that presentation
that we have the Crunchy Allergist, which is really a moniker for, okay, let's try to find a little bit more of the natural ways and the non-traditional ways in order to help with these common modalities, right? So like you're saying, yoga, because now, interestingly, one wouldn't think of yoga as a way to help with sinus issues or allergies. So like, whoa, let's enlighten people. Yeah, like what is it that you did find out about that?
So in part that there's not a lot of, rigid science, as we think about the different types of evidence we have, from really the best being a meta-analysis where you have all these different studies put together, maybe just under that, a double-blind, placebo-controlled, randomized, study.
It's like supposed to be like, which is like the A+ of studies.
Yeah, these are like, and you want studies that are on, huge numbers because that helps their strength. The problem is when you look at a lot of these more natural modalities, the studies are small and they're not perfect because they don't have the big budgets behind them that you would have with maybe, AstraZeneca or Merck or, one of these big pharma names that's going for FDA approval of something. And so, I think all of that has to be taken into context, but also in context with the risk of what you are proposing. The risks associated with yoga, pulled muscles, maybe the cost of a class is pretty minimal, right?
Or your yoga pants.
New Lululemon addiction, I don't know. But and it's compared to other things. And so I think really it's important as we think about some of these other modalities to look at the length of their track record, look at, are they present in many different cultures? Because I think there is absolutely a role for good science, no doubt. But I think there's also a role for considering it within context and within the idea of safety and having some cultural awareness of it as well. There's, I think, a lot of discussion about, colonialism or this idea that, the science that we have in the Western world is the end all be all. Whereas when you look at some of the track records of traditional Chinese medicine or Ayurveda or these other or medical systems that have been around for quite some time, that sole focus on Western medicine is maybe a little short-sighted.
So this is very interesting because as you really look at the trajectory of your career, not only have you become the Crunchy Allergist, but you also decided to get additional training, like you said, in integrative
medicine. In lifestyle medicine.
Lifestyle medicine. Sorry, in the lifestyle medicine. Yeah. And recognize with that, so with lifestyle medicine is understanding that the standard Western type of medicine and the thought process that we have been trained in, because that's how most of us are trained in just really traditional Western medicine. With lifestyle medicine, it's really pulling together not just from A equals B, but there are other social and physiological factors that really pulls into that. How have you been able to tie that together in your practice and what you're seeing, especially as an allergist?
Yeah, so I really kind of explored, there's, kind of three main ways of being trained kind of outside of kind of conventional medicine, if you already are like an MD or a DO. So there's lifestyle medicine, functional medicine, and integrative medicine. And I think they all have their place. And what I realized in kind of digging in was lifestyle medicine aligned more with what I was already looking to do in my own life and to help with my own health. And so really looks at how we can organize, our day, our daily habits into helping support our health and healing, which many times is contrary to what a standard, typical, American Western kind of day may look like. So, aiming for a diet that's much, has a greater emphasis on plants, a primarily emphasis on plants. How can we incorporate movement into our days so that we're kind of hitting ideally 150 minutes a week of moderate exercise? I'm still working on that one. How can
We
we
all are.
optimize our sleep, so that we're
Mhm.
getting the adequate rest we need? What are some ways that we can harness the power of our mind so we're not ending up in these, thought loops, so where our judgy brain is kind of talking us down, being critical.
Mhm.
That's where the coaching kind of came in. And then building community. So kind of knowing that really deep, meaningful connections with other human beings are incredibly powerful
Mhm.
in our health and healing too.
Absolutely. And I love that you're really tapping into all of these aspects because that's what makes us whole, right? And that's a part of not just living, but that's wellness and living with intention and really enjoying, like a lot of it we call like mindfulness, enjoying being in the moment and enjoying what's going on right now and not just worrying about what occurred, the mistakes that happened, or like, oh my gosh, how am I going to do this in 2 weeks? How about like the right now? So now you've pulled into a lot of that, and when we even think about like allergy and immunology and plant-based, how have you seen in the training that you've had with plant-based for those who have allergies? How is it helping, or those that you've been taking care of? Because I see some people are asking, like, are we talking about seasonal allergies or food? So, like, how is lifestyle medicine, have you been able to help your patients with that
There's
additional training?
there's so many aspects that come into play. I think one of the things that I see increasingly in the office is actually something I was not really trained in, which is
Mhm.
like food intolerances. So I have a lot of patients who will come to me concerned that perhaps they have a food allergy. They eat particular foods and they feel icky after eating them in one way, shape, or form. Many times it's gas, bloating, pain in their bellies, which is not indicative of an allergy, but actually more in line with an intolerance. And so
Mhm.
that's an area that my lifestyle medicine training and kind of additional work has really helped
Oh.
considerably with, in helping folks understand the difference between true allergy and the other symptoms that can occur. And then
Mhm.
how can we work to best improve gut health and
Mhm.
really help those symptoms improve over the long haul? The other place it comes up pretty often is my practice is at the university, so I see more adults there and parents. And so just this week, I already had two parents ask me, what can I do? I have young kids, or we're expecting our little baby. What can I do to help prevent my little one from becoming allergic like me? And so there
Mhm.
increasingly is data to say that, as best possible, if mom can eat a diet that's rich in plants and
Mhm.
is more of an anti-inflammatory diet, that can help benefit the health of the baby, decrease risk of A to P, so allergy, asthma, eczema in the baby. Um, Good skincare in the baby can be helpful after baby's born. So trying to keep that skin barrier intact, especially if little one has maybe some, tendency towards eczema, or
Mhm.
which essentially is a leaky skin barrier. And so the concern with food allergy is these kiddos with eczema are getting exposed to the food allergens through their skin before
Mhm.
they're getting exposed through their gut. And then, talking about early introduction of foods when the baby's able to eat, getting those in the diet as well. And then there is emerging data in the field to say that we see increase or improvement in control of inflammatory conditions of all kinds, including asthma, with an anti-inflammatory diet. So we're still young in this area, and it's an area that I plan to be contributing to this information that
Mhm.
in science as it evolves. Um, but there's a lot of room for growth as well.
Absolutely. Wow, that's wonderful. And before we even go further and start touching into more on Dr. Wada, you mentioned something which I think is very interesting for those who are young mothers out there, young as in not age rate, but I mean, like, you just had a kid and you're like, what in the world? I'm so confused. I don't want to break my baby. Like, and it's time to introduce food. That is one of the scariest times, because especially if you've been either doing breast milk or formula, you're like, whoo, okay, I finally figured out what formula the baby can use. Or yes, they're latching onto the breast, they look fed while they're gaining weight. Whoo. But then now we have moved on, because babies are like everyone, they're growing and they're changing. And now you're like, okay, now it's time to introduce food. I was allergic to this. You get all of these. Oh, don't give any eggs later on. Oh, you can't give any peanuts. Oh, kids are, peanut allergies are so rampant. What are some of the ways that you would say, as an allergist, for someone who is introducing foods to the young ones, what are some ways to do it that are safe?
Yeah.
To decrease the anxiety in the parents, but also to optimize, the nutrition and the exposure to the child to reduce this allergy.
Yeah, so overarching goal is we want our little ones to be exposed to a diverse range of foods, especially within, those first 3 years of life. That's really going to help establish a healthy gut microbiome that, may suffer some, hits here and there if little one needs antibiotics for an ear infection, or, other issue, other things, or, maybe helps if baby was born via C-section, or other things that we can't get around sometimes, from like a health and safety standpoint. But we know that really can help feed those good gut bugs and help those establish good kind of setting for good health. So as I think about little ones that I might have a little more caution with, if you do have a little one who has clinically significant eczema, so maybe needs to use prescription steroid cream to help keep that eczema under control. We kind of rate it as moderate to severe eczema. Those kiddos should be evaluated before they have peanut or for the first time. Other folks that should be evaluated before they have peanut is if little one has a known egg allergy. Those are two kind of things that are associated with a little bit increased risk of having peanut allergy. And so most allergist offices or academic centers are going to have kind of the mechanisms in place to help you sort that out. And usually it will just mean doing a quick little scratch test in the office to see if the baby is sensitized to peanut. So I think that's another little learning tip or pearl, is that a positive allergy test on its own without any clinical history is just called sensitization. So having that allergy protein or that IgE antibody, same thing, that is sensitization. It is within the context of those symptoms. So having rash and throwing up, or wheezing, or passing out, it's those two together that equal allergy.
Oh, okay.
Unfortunately, when we look at the information that we have, thankfully for peanut, for egg, for milk, we have pretty decent numbers, like cutoff numbers, to say, oh, if it's over this amount, we're pretty darn sure that this is going to be allergy. Like the odds kind of tell us this is a little more allergy. But the real gold standard is what happens when someone eats the food. And so that needs to be kind of taken into account, like what a conversation of like risk versus benefit and kind of the overall game plan. But a lot of times, if that scratch test is pretty small, we'll go ahead and feed a kiddo peanut butter in the office, make sure they do fine, and send you on your way.
Love it. And I love that little pearl that you gave, which is sensitization versus like the allergy. Because we do throw that word allergy around pretty darn. I think it is definitely a secondary word. Oh, I think I'm allergic to this, I'm allergic to that. But it could be a sensitization. And another word that you also invited into the conversation is intolerance. So you had the milk and, I don't feel that great. It doesn't necessarily mean you're allergic. It could be that you're intolerant to that particular food or so on. And so you said that when you do the scratch test, which, you're doing this in a controlled environment. And this is important for all who are listening. All of this is in a controlled environment where your doctor's there. They have all the medications to use to reverse any adverse effects that might occur and get you to the proper facilities, in a timely manner. So this is not something that you're just going to do at home and you're doing scratch tests on your own. No, this is all in a controlled environment.
And actually, we don't want you smearing peanut butter on your kiddos,
to determine that.
Because the worry is that if the immune system is exposed to the skin, as opposed to the gut's primed to tolerance. The skin is not. The skin, it appears in many cases, may be primed to create allergy. So don't do that.
Okay. So the skin is a barrier. And that's like,
yeah.
But the gut's like, okay, let me handle this. That's the gut's intention and its purpose. So I love this. Alrighty. So we talked about intolerance, we've talked about sensitivity, and now, we have some people who are just full-blown allergic. And as you mentioned, the skin is prone to fighting. So when someone's allergic, even exposure through the skin can even happen. So I said, what are someone's asking a question too. So we'll ask that question to Yvette. Thank you so much for tuning in. Yeah. So, allergic through this, what are some of the triggers that you've seen?
So food allergy triggers, there are kind of top 9, which I'm going to try to do from memory, which
we can do top 5.
No, this is milk, egg are like the 2 most common. My little one had egg allergy. Then we have peanut, tree nuts. So those include like cashews, almonds, hazelnuts, walnuts, those sorts of things. Soy. And then you have fish and shellfish, sesame, and what am I missing? I'm missing one.
We have the top 8. We have the top 8. Okay, so now
wheat.
Oh yeah, that's true.
A lot. And separate from celiac. So you can actually have anaphylaxis due to wheat in addition to and separate
from the intolerance and issues that occur via celiac disease. Oh wow. Wow, I didn't even know about that. Like people have, well, I know that there's, of course you can get allergic to anything, but I did not recognize that wheat was in the top 9 allergens out there. Wow. So someone is asking, what are some of the triggers for eczema? So as we described, let's just give a quick, definition of what eczema is, and then we'll go over, you gave a quick little tidbit. So we'll go over what eczema is, and then what are some of the triggers for eczema and some of the treatments we that are there, or to taper down into the inflammation that occurs in eczema.
So eczema is a skin barrier issue. Essentially, the skin barrier becomes leaky, and so moisture escapes more easily. Skin gets dry, it gets itchy. We tend to scratch it. That's one of the triggers that can egg things on. But it also becomes more permeable to the outside as well. So irritating or allergic things can make their way into the body a little more easily. So when we think about ways to treat eczema, one, we want to try to repair the barrier. Many times that requires a little bit of, in one way, shape, or form, decreasing inflammation and or treating infection, because sometimes, especially if you're scratching, we have bacteria naturally on our skin that can lead to bacterial infection. We also know for some folks, the immune system will actually make a response to bacteria that naturally live on our skin. So we have bacteria called staph that live in and on us. You may have heard of MRSA, for instance. That's kind of the scarier one. But those are staph bugs. And staph tends to make these toxins. Also sounds a little scarier than what it is, but essentially the immune system can make a response to this toxin, and that can essentially perpetuate this inflammatory response for some folks. So for some people, we're trying to decrease colonization of staph. Other times we're using a little bit of topical steroid, or there are other topicals as well that are non-steroid based that can calm down inflammation. And then we're repairing the barrier with a lot of times a very bland, thick emollient lotion cream. Essentially, you want something that's in a tub. You want something that's fragrance free. You want it to be boring.
Yes.
And actually harder to apply. Like, generally speaking, things that come with a pump more often are thinner than what you would want. You want something that's kind of greasy.
And
That's
like digging
lock in, yeah, that's going to lock in the moisture.
it.
You also want to, so taking a bath can be helpful, cleaning off the skin. The skin will absorb some moisture as long as the bath's not too hot. You don't want something like, scalding. And then as soon as you get out of the tub, pat dry just a little bit, leave the skin damp, and then put all that nice lotion all over top, especially those areas that are rough to the touch or itchy. And you may, depending on what your doctor or healthcare professionals recommended, you may put some of those topicals on prior to that. The other things that can trigger, so fragrance is a huge trigger, both allergic and irritant. The dirty secret of kind of the cosmetic and personal care industry is that fragrance is not one ingredient. It's actually more often about a dozen different ingredients, sometimes natural, many times not, that are called, there are different types of chemicals. Phthalates are one of them. They have been found to be endocrine disrupting chemicals in addition to allergens. But those are one of the top contact allergens and problems that we run into. So that's why I said you want something that's boring. You don't want something that's like smelling nice. And even things that have natural essential oils, for some folks with eczema, natural does not always equal safe. Although I'm the crunchy allergist, I am naturally minded and scientifically grounded. So
love it. There goes the crunchy part.
Yeah. So those, may smell wonderful, but for someone who's prone to allergy or prone to sensitive skin, that's not a great fit for them. And then one other trigger that is, I think, not talked about nearly enough are viral infections, or and that can be a huge trigger, especially for kiddos that are, in daycare, preschool age. They are like little germ factories, right? Like my little one, who's almost 8 months old, I think we've probably had 2 weeks since he started daycare where he has not had snot come
out. Had
a
runny nose.
Yeah. And so, there's a lot of
the first 2 years, you just have to just.
It just is.
Yes.
And you can rack your brain sometimes trying to come up with, okay, because the human brain loves to make connections. We especially love to make connections to food. And so I think there's a lot of discussion, especially in parenting groups and social media groups, about how maybe we should eliminate take all these foods out of our kids' diet, because I think it's egging on their eczema. The science would say that's not the case. And actually, you really want to keep a kiddo, especially a kiddo with eczema's diet, broad, and keep the allergy prone foods in the diet, because even if they have the sensitization or they have that antibody, we want them to go towards tolerant. We want their gut seeing that food. As long as they're not having a more significant like anaphylactic reaction, we want that in their diet so that they're edging towards tolerant, as opposed to flipping over into true life-threatening allergy.
Interesting. So with the exposure, which is the food being into the gut, the body itself is going to get to a point where it's like, I recognize you. Hey, I guess you're back. There you go again. And then the tolerance section is like, okay, so then you can stay. I'm not going to go onto full blown, like you said, anaphylaxis, which is the worst of all type of allergy, which is the true emergency of allergy. I love it. I hope that answered your question, Yvette. That was a very, very great answer, Dr. Wada. So, to summarize, there are a couple causes for eczema, and the descriptive is eczema is really a leaky barrier within the skin. So if it's leaky, things coming in, things going out, and so with that, bacteria can go in, that can trigger the eczema, the natural bacteria that's on our skin, such as the Staph aureus. And then we also have our lovely kiddos who were in daycare, and boy, oh boy, they are the snotty factory for at least 2 years in a row. And they have the viral infection, and that can also help to flare up. So that's the infectious part. And then you have the allergen, the exposure. You have the trauma that you're scratching your skin because it itches, and then you're increasing the inflammation, which is another thing that causes the irritant to that. So you have all of these barriers, but one of the great things that you've mentioned is that when you have a young kid who does have the eczema, is try to keep the diet as broad as possible to really have the body move to the intolerant phase, and that it's recognizing these food. It's no longer being triggered, at least adversely in a harsh way, which is the anaphylaxis, by these foods. And then in order to really help us a treatment plan for those with eczema, you're taking a bath, warm, not scalding hot. While you got out the shower, or the bathtub, you're doing a pat dry. You're not scrubbing that skin dry and increasing that inflammation. You're patting it dry. You want to keep a little bit of moisture, and then you start adding on the layers of your barriers, right? You're either the medication that you've been prescribed, or that juicy, non-sexy, thick cream that does not have any fragrance, that's not in a pump. It's thick layer right there. You have this beautiful barrier on. You're keeping the moisture in. You're decreasing the inflammation. With that barrier, you're trying to reduce the introduction of anything outside into the skin, and all the moisture from the inside, you're keeping it in and not having it go out. So lovely, lovely description of that. Alrighty, so you have been giving us a lot of pearls, but you know how we do here. This is Dr. Tamara Beckford Show. We're not going to just ask you about how you're doing with everybody else. We're going to find out about you. So we want to know, Dr. Wada, what are some of the things that you yourself are doing for self-care?
Yeah. So one thing is really that we started thinking about actually right before, kind of the summer before the pandemic, is we put in some raised beds in our backyard. We took out this old dilapidated shed that was kind of more like a haunted house, and we put in some raised beds. And unfortunately, it was like late enough in the season where we didn't get to plant anything that fall of like 2019. But here comes spring of 2020, and we're like stuck at home. So I mail ordered some seeds because we weren't going anywhere. And we started our little gardening journey. And so that's been a really fun way to, one, increase some of the plants, that we have easy access to and to eat, but also get my kiddos involved. So I am a mom of 3 now. At the time we just had the 2, but Charlotte is 6.5, Josie just turned 4, and Oliver is almost 8 months. And it's a way to get them out, to let them get their hands dirty. That's, one other thing we know that helps, steer us away from allergy, is just letting kids get dirty. So we've had some fun experimenting with, okay, what grows, what didn't, what took up too much space, what was like, a total waste, because, although we try to eat certain things time and time again, like turnips are not my favorite. And so
I love the honesty. I was able to grow it, but
Whereas, we love broccoli, but broccoli takes up a ton of space. So, this has been a real fun, like, experiment, get curious, to get our hands dirty. And it's been fun for my husband as well, because he loves tinkering. And so he has kind of set up this whole, like, strategy for watering the garden. And so it's been this, like, little family adventure.
I love it.
Yeah. So that's the one thing we've done for self-care. And then something I am aiming to do a little bit more often is I really love taking a hot bath. So I know I just told folks with eczema not to take real hot, but I love taking a hot bath, like taking time to read a book, like while I'm in the bath. It's a little challenging though when I have littles that want to join me, which is.
What do you mean? You mean those fingers underneath the door doesn't help with your relaxation period?
They figured out how to unlock the door is the problem.
Oh wow, that.
So that's one of those things where some of the coaching comes in, where you kind of reframe it as they're only young ones and this is wonderful, but
and mindfulness
after bedtime is nice mommy time. Yeah.
I love it. I love it. Alrighty. So before we go, we have another super fun question that we ask all of our guests, and we need to know this too for you. So, Dr. Wada, if you weren't a doctor and or a gardener, because we're going to pull that out, what would you be?
I would love to be a host, like on a radio show or a TV program. I recall back in high school, we had career day. And unfortunately for career day, medicine was not an option because of some of the privacy concerns and so forth. So I spent a day at the local television station and I got to write a story and I got to help put that together and produce it. And I really love that role of kind of being a spokesperson or being able to educate, kind of more broadly. And so I think it would be some sort of position in media.
Love it. Love it. Love it. Love it. Well, guess what? You're on the show now. So you're there. Oh my God. Okay. So now I know that, I've had a great time having you on. You've given us a lot of wonderful information about allergy, and especially for those, I know Florence was asking, and even Yvette in the chat were asking about eczema. And we really dug into giving people some great information about eczema, not just for themselves, but also for the loved one, and especially for the kiddos, because you took the time to do training, not just in adults, but in adults and kids. And then you went further and did additional training on allergy and immunology, and then also on life coaching, and then also on lifestyle medicine. So you just gave us all of that tapped up into this one segment. So now I know people are listening and they're like, oh my gosh, does she have anything going on? I need to know. Does she have something going on? Because I'd like to work with her. I'd like to be part of her world. So tell us, where can they find you?
So the main hub to find me is my website, which is crunchyallergist.com. And there you'll find the blog, links to the podcast. And then I also do work with clients. So I have partnered with a registered dietitian because I really feel passionately about the role of the medical team, that we all have our genius zone. And so Jen and I have partnered together to really combine her anti-inflammatory nutrition expertise in my life coaching into a program. So we do have a program called Air Squared, which is anti-inflammatory living redefined and autoimmunity reimagined. And so there we work with clients to help them kind of really break out of those limiting beliefs and incorporate more sustainable habits to help support their health, as opposed to kind of these big elimination diets and the things that are harder to stick with long term.
Absolutely. So all of that information they can find at crunchyallergist.com.
Yes.
Wonderful, wonderful, wonderful. So the Crunchy Allergist, what social media can they find you on?
So I am all places. So I'm on Instagram at Crunchy Allergist. Twitter's the one I'm Crunchy Allergy. It wouldn't let me have just. And then Facebook as well. And then we are soon. I haven't said this out loud. So this is first. We are launching likely next week, our YouTube. So
wow.
the YouTube will have the scary domain for a while until we get our first 100 subscribers, and then the game plan is to switch that over to Crunchy Allergist too.
Wonderful, wonderful. So you will be able to find all of this great information on the Crunchy Allergist here with Dr. Wada. So she's on all the social media platforms as the Crunchy Allergist. Only on Twitter, she's the Crunchy Allergy. And soon to come, first heard here, we have the YouTube channel that's coming. So when all of that comes out and you see all the information, make sure that you subscribe so she can get to those 100 and she can get that Crunchy Allergist. You don't have to think about those XYZ exclamation underscore all those other side
saying like the creepy, you know,
the creepy symbols. So we'll just go under the Crunchy Allergist. So thank you so much, Dr. Wada, for stopping by the show. You gave such great info. I had a wonderful time. And like I said, for all of you guys who are watching, I know that this is absolutely a 5-star, especially if you yourself have an allergy, or maybe you don't have an allergy. Maybe you've been using the wrong word. Maybe you're just sensitive, or even worse, maybe it's just an intolerance, right? So go back and listen. Yeah, you'll find out the definition of all 3 of those words that I just used. Or if you know or have somebody who has eczema, we gave some great info to try to taper that eczema. If you are a new mom, we gave some great info to taper down how you can introduce the food and what you should be introducing to your kids, getting all that scariness out of the way. All of this you're working with and pairing with your healthcare provider. We're just providing info. We're not your doctors. We're just trying to educate and inform you to make the world a less scary place for you, right? Alrighty, so Dr. Wada, do you have any last words for us?
Save your money on the food sensitivity testing. And I have some blogs and posts on this, but save your money.
Wow, more to come. Ooh, I love it. You just dropped a little gem. Now I'm like, So go to her blog on the Crunchy Allergist and find out why you should be saving your money on those food sensitivity testing. I love it. Cliffhanger. So I am Dr. Tamara Beck from the Dr. Tamara Beckford Show. Thank you so much for joining me. And as I said, this was a 5-star, absolutely a 5-star episode. So I hope you do listen and give us a 5-star there on any of your Apple devices that's out there, so that more people can hear and get exposed to this. We are actually one of the top 5% podcasts in the world. So let's keep it there. Let's aim for 1%. Woo-hoo! That's right. Thank you so much, everyone, for listening. And we'll see you guys next time. Bye-bye.
Thank you.